Health Safety Weekly. Preventing swimming-related illnesses. Diarrheal illness. How exposure occurs. Millions of germs can spread if someone with diarrhea contaminates the water with stool. One person with diarrhea can pose a risk to an entire pool. Germs can also come from feces washing off swimmers. Prevention. 1. Stay out of the water if you are sick with diarrhea. 2. If you have infectious diarrhea, do not return to the water until at least 2 weeks after your diarrhea has completely stopped. 3. Never defecate in the water. 4. Avoid swallowing the water. 5. Take kids for bathroom breaks and check diapers every hour. 6. Change diapers away from the water to help keep germs out of the pool. Remember to wash your hands afterward or use an alcohol-based hand sanitizer that contains at least 60% alcohol. 7. Before entering pools, splash pads, and hot tubs, take a 1-minute shower. This rinse will remove most dirt, sweat, and oils from your body, which can otherwise use up the pool chemicals needed to kill germs. Swimmer's ear. How exposure occurs. Swimmer's ear, also known as acute otitis externa, is a bacterial infection that occurs in the outer ear canal. It is usually caused by water that remains trapped in the ear for an extended period, which can degrade the protective wax and skin, creating a moist environment where bacteria can thrive. Signs and symptoms. Pain when tugging on the outer ear or applying pressure to the tragus, the part of the ear that sticks out in front of the ear canal. Itchiness inside the ear. Drainage from the ear. Redness and swelling in the ear. Prevention. 1. Keep your ears as dry as possible. 2. Use a bathing cap, earplugs, or custom-fitted swim molds while swimming. 3. Thoroughly dry ears after swimming or showering. 4. Use a towel to dry the ears well. 5. Tilt your head back and forth so that each ear faces down to allow water to drain out of the ear canal. 6. Pull the earlobe in different directions while facing your ear down to help water escape. 7. If water remains in your ears, you can use a hairdryer on the lowest heat and speed setting, holding it several inches away from the ear. 8. Consult your healthcare provider about using ear drying drops after swimming, but do not use these drops if you have ear tubes, tympanostomy tubes, a punctured eardrum, swimmer's ear, or any ear drainage. 9. Avoid inserting objects into the ear canal, such as cotton swabs, pencils, paper clips, or keys. 10. Refrain from trying to remove earwax, as it helps protect the ear canal from infection. Hot tub rash. How exposure occurs. Hot tub rash typically develops a few days after using a poorly maintained hot tub. It can affect people of all ages and is often more severe in areas where a swimsuit traps contaminated water against the skin. Signs and symptoms. Itchy, red, and bumpy rash. Pus-filled blisters around hair follicles. 1. Remove your swimsuit and shower with soap immediately after using a hot tub. 2. Wash your swimsuit after each use. 3. Use test strips to check the water quality, especially in hot tubs, for adequate disinfectant levels and pH. 4. Maintain chemical levels for chlorine, at least 3 ppm, bromine, 4 to 8 ppm, pH 7.0 to 7.8. Legionella in hot tubs. Legionella is a bacteria that can lead to a severe form of pneumonia known as Legionnaire's disease. The bacteria can also cause Pontiac fever, which is a milder illness that does not involve pneumonia. How exposure occurs. Hot tubs have been associated with Legionnaire's disease outbreaks. Individuals can contract Legionnaire's disease or Pontiac fever from hot tubs when they inhale mist that contains Legionella. These bacteria can proliferate in water systems, increasing the risk of exposure. Signs and symptoms. Cough, shortness of breath, fever, muscle aches, headaches. If you have used a hot tub in the last 2 weeks and experienced symptoms of Legionnaire's disease or Pontiac fever, see your healthcare provider immediately. Be sure to inform them that you have recently used a hot tub. Prevention steps and strategies. To ensure hot tub safety, follow these steps to test the water and verify that the hot tub is being correctly maintained. Purchase test strips from a local retailer or pool supply store and check the expiration date. Use the test strips to check the following levels. Free chlorine level should be at least 3 parts per million ppm. Bromine level should be at least 4 ppm. pH level should be between 7.0 and 7.8. If you find improper levels of chlorine, bromine, or pH, inform the hot tub operator or owner. For a more in-depth look at swimming-related illness, check out our blog. Also, please like, follow, and subscribe to our social media. It only takes a second and it helps small businesses like mine stay in business. Thank you so much.